Good afternoon, Britain. It is now 1:39, and the number of people claiming disability benefits in the UK is soaring.
Yes, a new report from the Institute for Fiscal Studies, well, their data shows that under 4 million people, just under 4 million people, are claiming these benefits now, with a 150% increase. Yes, you heard that right, 150% increase by the under 40s claiming disability benefits in the past 4 years.
Wow, now that is a stark statistic. There's also been a sharp rise in the number of benefit applications on mental health grounds. This is where it's really growing, mental health claims.
Well, joining us now is Shimeon Lee, a researcher at the Taxpayers Alliance, because, Shimeon, this is a pretty stark reality. We had a government for the last few years saying they wanted to clamp down on benefits, but actually we've seen a massive spike.
Well, thank you for having me. You're absolutely right that there's been a massive increase in the number of people on disability benefits. So if you look at the number of new claimants, that's people starting disability claims, that number has actually doubled from about 250,000 before the pandemic to about 500,000 now. And that's a massive increase, and that's just new claimants. And once they start claiming disability benefits, they tend to stay on it for quite a long time. And so if you look at the number of people still on disability benefits, health-related benefits, 5 years after they start the claim, 70% of them are still on those benefits. And that imposes a massive cost for the country. And it's something that the public finances at this current moment simply cannot afford.
And disability benefits, it's quite a broad term, isn't it? It's a bit of a catch-all these days. You can have disability benefits for things like ADHD.
We're absolutely right that a lot of this increase has been fueled by an increase in the number of new claimants claiming these benefits for mental health conditions. So if you look at the statistics, about 40% of new claims have to do with mental health. That's up from about 28% before the pandemic. And a lot of this is because these conditions, these mental health conditions, would not have been considered medical conditions in the past, but are now increasingly being defined and diagnosed by medical professionals as disabilities. So if you think of things like depression, things like anxiety, in the past, we wouldn't have thought of these as disabilities, but now they are. That means people are increasingly entitled to claim disability benefits. And this is something that the system simply was not designed to cope with. If you look at disability benefits, the sort of predecessor to that was the mobility allowance benefit that was actually introduced in 1979. Now, back then, the sort of definition of disability was very different from the definition that we have disability today. And thus, the number of people claiming disability and the amount that the government intended to spend back then was very different from today. And so the current system really is not adapted to our modern definition of disability and the changing healthcare landscape in the United Kingdom.
It's an incredibly concerning picture, because I suppose there'll be many people who are almost incentivized down a more medicalized path, down a path away from work and towards, sitting in your bedroom alone. And that can't be good for your mental health. Sometimes routine and actually seeing other people is perhaps the best thing for you. And yet we have this system whereby we sort of incentivize people away from those very environments that could actually help them. I mean, how do we fix this?
You keep me out of a depression, Tom.
I
Every day, keep me out of a depression.
How is it fixed, Shimeon?
Well, one thing that we can do is to start means testing some of these benefits. If you look at disability benefits, that's actually not means tested compared to incapacity benefits, which are. That means that someone on a high income, for example, can claim disability benefits, and that's something that should not be happening. In fact, that's something that doesn't happen in other countries, but does happen here in the UK. Another thing we have to do is start clamping down on fraud. So disability benefits and incapacity benefits are actually less stringently policed than joblessness benefits, which has led to an increase in fraud. The Department for Work and Pensions actually recently pointed out that it loses about £6 billion a year because of fraud. And that's only set to increase by about 5% per year over the next 5 years. So those are two things we can do: look at fraud and as well look at how we can start means testing some of these benefits.
Fraud and means testing, some things for politicians to have a look at. Shimeon Lee, thank you very much for joining us.